So welcome back, everybody. So now what we're going to do is the actual scene with a patient with us. Keep in mind that we've been discussing the importance of the buyer's journey as a tool to communicate. And we've discussed also that first critical step is the awareness stage. So our patient here, Monica, hasn't been in the practice for quite some time. And the idea today is to make her aware of what condition she brings or what condition she has. So you'll notice in the back that we have this screen with a very cool greeting feature that we've incorporated over the last few months, which is the screen with their name on top of it. What that does is create that sense of we care about the patient, we are waiting for the patient, everything is set for the patient. And by doing that right there creates an incredible energy between our staff and the patient. She feels incredibly welcome. Patients walk in and you don't know what type of a day they've had. You don't know how they feel. Who doesn't like to walk into a place and have people know what your name is? By them seeing their name, that just creates such a positive energy. You know, the patient feels important. The patient feels we care for them. The patient feels we're ready. It is such a simple thing to do, to greet them in such a way. They say, well, this room is ready for me. People care about me. So it just, again, what we have all the time is people taking out their, cell phones and taking actual pictures of the screen saying, wow, these guys put my name on that screen. And it's so simple to do. So what's gonna happen momentarily is, once I greet her, is that a staff member is gonna come in and it's gonna take 3 to 4 pictures that will allow us to capture what her clinical condition is. Now, this does not mean that I'm not going to examine her, but what it means is that we now have a tool that will allow us to communicate with the patient much better. Now, it's going to take probably 3 to 4 minutes as we process these pictures and put them up on the screen. So in the meantime, as we take the pictures, we will be able to recognize what condition is the patient in. And if there's anything that really catches our eyes that's worth showing her as we're processing those images.
Bite down and hold the retractors, please. Thank you. Right. Now this. And hold and pull.
So what's going to happen is if we detect a given clinical condition that we feel is worth sharing with her, what we're going to do is that we're going to upload a patient educational video that will resemble exactly what her condition is. So this video will take a couple of minutes. As she sees this video, we'll then come back and show her clinical pictures. And by doing both, that will really create an impact that the patient will be much more aware of what exactly is happening. We're going to do that right now, and I'll walk you through the other steps as we go by. So Monica, as you saw, we've already taken some pictures. I've examined you clinically. And what we want to do as we process those images, we'd like to walk you through a very small video that depicts the condition that we found that you have clinically. And this will give you a much better understanding of what's happening. So let's play the video, please, for me.
Even after a tooth has been restored, sometimes decay can reappear and compromise the structure of the tooth all over again. Unfortunately, in these cases, the same process that created decay in the first place can create it again. Bacteria works its way into the areas of the tooth surrounding and supporting the filling, and the tooth begins to deteriorate as a result. As the decay worsens, the tooth continues to weaken, which can result in cracking, pain, and potentially tooth breakage or loss. If caught early enough, the decay can typically be removed and the tooth refilled or crowned. However, if left unaddressed, more serious procedures might be needed, such as a root canal, bridge, or dental implant.
So that's pretty much what shows in this animation what we found that's happening clinically. As you can see, the video goes all the way depicting what could potentially happen. You're not there yet. Obviously, you came symptom-free, so there was no pain. You actually were not aware of this happening in your mouth. Next thing we do is we show the patient the images that we took, and we're able to put them side by side so the patient will be able to truly have a much better understanding as to what her clinical condition is. And again, this allows us to communicate at a total different level. Here, we can see the actual images. Now, in the video, you saw that it was just that one tooth that was restored. We realize that in your mouth, we have plenty of restorations. In fact, pretty much most posterior teeth have large amalgams. Now, do we need to change all of them? And the reality is there are some of them that stick out as more urgent, if you will. So what we've done is identify an image that's very consistent with what we showed you in the video. So you see that clinical picture there shows the large amalgam restoration and how you can see that there's recurrent decay. There's like a cavity already formed. So that this pretty much shows that if we choose not to do anything, there's a very good chance that eventually we'll find or we'll have what you saw in the video. That tooth is going to end up cracking. There's going to be, additional recurrent decay and probably the need for root canal therapy. So the reason why we show you this is that we feel that it really reinforces the sense of awareness. And from here, we'd like to hear you out as to what comes to your mind as you see the video and the image.
I actually do. Well, it's very clear after the video what's my condition. And my question would be, is this going to hurt me? Because you know me, and I'm always a little afraid of pain.
Right. And the reality is that we're going to be working. This is such a straightforward procedure. I cannot see how you would experience pain. We're going to block the nerve. You're going to be nicely numb, so you're going to be fine. There shouldn't be any type of pain or discomfort while we do the procedure.
Okay, and something else I would love to know, is this going to be like numerous visits or in one visit, or how does this work?
Again, great question. So when we are replacing a restoration this large, most likely we're going to be doing an indirect restoration, which means we're going to remove the pre-existing restoration. We're going to clean out the tooth, clean out all the decay, which means that by then, most likely we'll end up with some type of a cuspal coverage, which means it's not going to be just within the tooth, but it's going to kind of like cover the tooth a little bit. Maybe in a way of what we call an overlay or an onlay. But if we feel that the decay has spread beyond, we'll end up doing a full coverage restoration, which is a crown. So that means we cannot do it in one stage. It means we're going to end up doing it at least in 2 appointments. So one of them, we get rid of the decay, we clean the tooth around, we make an impression, we send it to the lab, and then we'll have it back, and we'll be able to finish this in a second appointment.
Okay, sounds good, and I definitely think we should go ahead and do it. But my next question would be, how expensive is this going to be?
I normally don't talk about prices in the dental chair. Our office person, the front desk person will give you a fee estimate, but the short answer is no, it's not going to be that expensive.
And you definitely think it should be done right away, so it doesn't get more and more complicated.
And so we don't have a crystal ball. We don't know how long it'll take for this tooth to crack one day on us. What we know is that there is recurrent decay. We know we have a large restoration, and so I would say the sooner we work on it, the better.
Well, for sure, I feel very comfortable with the explanation. It's very clear what my condition is, and I think we should go ahead.
Super. So I guess then we're going to move on, probably make some impressions so we can fabricate a provisional for you, and the front desk will let you know as to when is the next appointment and all the pertinent information regarding the next appointment.
Well, perfect.
Does that sound like a plan?
Yeah, sounds like a plan.
Cool.
Thank you.
Thank you, Man. So I hope you've enjoyed this presentation, and I'd like to first acknowledge I think I know what many of you may be thinking. Of course, this worked that well since it was being filmed and it was probably set up. Well, first I want you to know that every patient that you see us speaking with in these courses are actual patients. And what we say and how we say it, it is exactly the way we do on a day-to-day basis in the practice. Until our patient came in, we didn't really know what we would find, but at the same time, it is hard without having hidden cameras to make something 100% natural. Think about this. When you have 2 cameras, 4 lights, and 3 extra people crammed into your operatory, it's almost impossible for things to look 100% natural. What I hope you see here is the power of making something seen. The power of something being noticeable and relevant to the patient. Recurrent decay around large fillings or poorly placed crowns is something we see every day. And we know that the cost of inaction is huge. But when nothing hurts and the patient have not experienced the consequences, it can be hard to make a patient see that investing in a solution is really necessary. I do not know how much your crown's fees are, but I know that they are more than 0, which is the cost of the patient doing nothing. When they have been made fully aware of their condition, patients can make an informed decision. And if they do choose to put off treatment, and if for whatever reason eventually the tooth cracks, they should no longer be able to blame us. So as you think about how you apply this in your practice, it is our job to simply do 3 things. First of all, make the patient aware of what we see. Help the patient understand the consequences of doing nothing. And thirdly, of course, to finally help our patients.